Hello dear friends, this is a case of a male patient, 57-year-old, with a history of HIV, AIDS patient, and known cerebral and miliary tuberculosis and multiple brain and spinal lesions. And he presented to the emergencies with a 3-day history of worsening dizziness, ataxia, nausea, and here is a previous MRI. This is the dark fluid. We can see that there are multiple lesions in the brain and the cerebellum. I will show you the images after the IV contrast. So let's have a look. Here is a very tiny one, very bright lesion. Another one. Here is another one, a little larger, surrounded by edema. Multiple smaller. Here. Most of the lesions are well defined. They have smooth and enhanced peripheral rim, and they are surrounded by edema. This is a quite unusual case, that's why I would like to present it to you. This is another couple of lesions in the cerebellum, and another one in the upper spinal cord. Here is another view in sagittal image. So there are multiple lesions in the brain, in the cerebellum, and in the upper spinal cord. A CT scan was done in the emergency department, and what we can see is that the perilesional edema in the right cerebellar hemisphere is increased, and there is a degree of effacement of the fourth ventricle, and these findings can explain the clinical appearance of the patient. Here is the post-contrast CT scan. We can see that there is enhanced peripheral rim and hypo-enhanced, hypo-attenuating center in the lesion. And I will scroll the images up and down to have a look in these multiple intracranial lesions. Here is another one, an enhanced lesion surrounded by mild edema. Here is another one which is slightly larger, and here a multiloculated lesion. Tuberculosis remains an important public health problem in developing countries, and in fact it has become more prevalent in the last few decades with the advent of the HIV AIDS epidemic, and furthermore disseminated manifestations, mortality rates, and multi-drug resistant tuberculosis have increased. I would like to mention that central nervous system tuberculosis occurs in 5 to 20% of HIV infected patients with tuberculosis. And commonly, cerebral disease due to Mycobacterium tuberculosis appears as tuberculomas and rarely as a brain abscess. Once again, I will scroll the images up to have a look to these rare lesions, unusual lesions. Dear friends, thank you for watching. Please leave your comments to this video, and you can consider to subscribe to my channel. So see you the next time soon.